been writing into us, so it's it's sort of formatted, but I think they're important. When
Of
can a
course.
citizen with comorbidities register for a dose? Any number of people have been wanting to know.
Of course, again, right now we are looking at the healthcare workers and frontline workers. There will be, of course, amongst them, people also with comorbidities. And when we go into the larger priority groups, which are people over 50, there will be very large number of people who have various kinds of comorbidities. You will just have to state what your comorbidities are, and you will know whether you can get vaccinated. And indeed, for a very large range of comorbidities which are sort of relatively more prevalent, there will be no issue at all in being vaccinated. If there are some where you should not get vaccinated or have it under greater supervision, you will be told.
So, sir, the way this would work is through CoWIN, the app. And therefore, if there is, for example, an individual, once this goes out into, once senior citizens are allowed to actually access it, or those with comorbidities are allowed to access it, they can just spell out that they have a comorbidity. How does the government know that that is the truth?
So there will be multiple layers of cross-checking.
I see.
First of all, there will be a layer in which people have, smartphones or feature phones and have OTP mechanisms of checking. They will get a registration, ID, which can be, they can use their Aadhaar, other forms of registration, ranging from your PAN card or your, similar to an election, all the other identification. And therefore, one knows who the person is and what they're declaring. I think the focus really is not so much about how people will try to violate these kinds of things, but how they can be enabled. That's number one. There are also a large number of people who will not have feature phones, and there will be families in which people want to use their relatives' phones, for example, for registering and so on and so forth, because they don't have a phone, others have. These are the kinds of mechanisms which have been addressed by the health ministry to ensure that anyone who is, with these kinds of situations, not having access to the platform directly, also is verified and put in a manner which enables them. The approach is to enable those who need vaccination to get it, and not to look at it from a perspective of how people will violate the system. In some sense,
that's such an important point. That there's an element of trust between the government and people. So if you do say that, look, I am unwell, I have comorbidities, a lot of people may not have their health records on them and yet may be acutely diabetic.
Absolutely.
So it's trust. The bottom line is trust.
And flexibility, so that those kinds of matters that need to be addressed can be established. This, by the way, is not unusual. I mean, not only not unusual, it is standard in any vaccination program. In our childhood vaccination program, it is standard. You don't go and, just vaccinate someone, but it's a context. You find out, about the child, what the situation is and everything, and then vaccinate. So this is something which, our healthcare system is used to. It now has to scale it up in a manner which is, enormous.
That's really interesting, sir. How much will the entire inoculation drive eventually cost? And I mean, I know the center will pay for a part of it, obviously, but will states also be asked to chip in?
We have a range of programs ranging from complete payment of the vaccination by the central government, as you're seeing in this case, partnerships later on with other governments, partnerships with CSR and philanthropy and so on later on, insurance programs of various kinds, and very, very importantly, the scale of this is such that we are not going to see this as a market of a competition of high pricing. I mean, everyone all over the world realizes the key importance primarily of getting vaccines to everyone. And therefore, I am convinced that as more vaccines come in, as our own manufacturing ramps up, remember all these vaccines we're talking about are going to have a substantial base of manufacturing in India. I don't see pricing and access and equity as something which will be compromised.
All right, but you don't know right now if the states would be paying a part of it and the center, or is it going to come from everybody? Once this